Well, let's discuss Canada's level of preparedness for the coronavirus outbreak and what might come next in this country. Arif Virani is the Parliamentary Secretary to the Minister of Justice. Garnet Genuis is the critic for Canada-China relations for the official opposition Conservatives. Don Davies is the health critic for the NDP. It's good to see you all tonight, gentlemen. Thank you for being here.
Great to be here.
Mr. Virani, let me start with you. The head of the World Health Organization warned today that even rich countries who think they're safe and have good plans in place could be in for a surprise with this virus. Is Canada ready for any of those surprises?
I think Canada is ready. I mean, we've already demonstrated that. We've learned a lot from SARS about 15 years ago. We've got a lot of very competent public health professionals in place. We've got a very robust legislative response to the Quarantine Act. We've seen the Trenton exercise go well. We've got people quarantined in Cornwall. We've got people at all of the frontiers in terms of the international airports that receive passengers from abroad. So we've got a lot of mechanisms in place to handle this. And we anticipate that there will be more cases, but we feel like we've got a system in place that's going to reassure Canadians that this is under control.
All right, Mr. Genuis, we've heard from public health officials in Canada that the risk of transmissions in this country is still low. Yet we have the Minister of Health urging Canadians to consider stockpiling medicine and food in case the virus strikes them or their family. What does that messaging suggest to you?
Well, obviously, when Canadians hear that message, they're going to be quite concerned, and we're asking questions aimed at being constructive on this. It is noteworthy that other countries in the early phase certainly were taking some steps that Canada was not taking. So we've asked the government, why is it that Canada chose not to take those steps? And the government is obviously part of conversations on this that other parties are not part of. But we're asking constructive questions about why maybe Canada hasn't taken all of the same steps that some other countries have, and we're hearing those responses, and we certainly hope that everything goes as well as possible.
But we have 13 cases in this country. So far, we don't seem to have any community-to-community spread. We've seen some spread between family members because of typically travel outside the country. Does that suggest, look, our record speaks for itself. We have 13 cases, no outbreaks in communities, transmission from community to community, or is that being too smug?
Well, I met with members of the Chinese community in Toronto on the weekend, and I know there is a lot of concern, and what was expressed to me in the context of those conversations was a desire for stronger screening, stronger safeguards, and stronger mechanisms that are more reflective of what we may have seen in some other countries. It is noteworthy that there have been some countries where there's been sort of all of a sudden a very dramatic explosion in the number of cases, and nobody wants to see that happen in Canada. Again, we're trying to ask the government questions about what steps they've chosen to take and chosen not to take, and be as constructive as we can be in that conversation.
Mr. Davies, you've raised some repeated and serious concerns suggesting that we're not as prepared as we claim to be, or at least Canadians aren't hearing enough about a plan. What's your big concern?
Well, first of all, we're very concerned about the news of the new cases in Iran and Italy. And as well, there's comments by Mr. Macron in France to the extent that they think a pandemic in France is likely. This is the very first time that the number of new cases of COVID-19 outside of China exceeds the number of new cases inside China. It appears clear that many countries of the world are preparing to change their policy from containment to one of preparing for a potential pandemic. Now, the response to the Canadian government, I think, is slow, and I think they're getting behind on a number of fronts. Internationally, we have Canadians in Iran. There doesn't seem to be any plan to repatriate them. Domestically here, we have these comments of the Minister of Health that came out of really nowhere to the extent that Canadians should be stockpiling, which is very contrary to the position she's taken up to now, which is, we only have 12 cases, risk of transmission is low, etc., which has created a lot of alarm. And finally, we have the nurses in Canada saying that the federal guidelines on masks is not sufficient to protect frontline healthcare workers or patients.
Mr. Virani, Canadians, what about that suggestion of a mixed message from the federal government? One hand, low risk to Canadians of a wider outbreak, and yet the health minister suggesting that stockpiling food and medicine, not a bad idea. What are Canadians supposed to think of that?
Well, I don't think it's a mixed message. I think what's important is that the situation has been handled well thus far because of the competence that we have in terms of leadership, in terms of our healthcare professionals, and the statutory mechanisms that we have available to us and what we learned from SARS. Second point is that Patty Hajdu and Minister Champagne are reflecting what we're seeing all around us, why we're talking about this on your panel today. This is spreading to many, many countries well beyond China, South Korea, Northern Italy, Iran, for example. What we're urging is people to be realistic realistic about the chance of further cases in Canada, and people to take some autonomy about their own situation in terms of doing proper research, informing authorities, and reporting to authorities, most importantly, if they believe they may be symptomatic. That is fundamental if we were to maintain the good response we've had thus far, because what's important is that when people have felt symptomatic, they've alerted hospitals in advance, they've put on a mask, so people were prepared to receive them and isolate immediately.
Mr. Janis, we did hear at the Health Committee yesterday a top health official saying, look, yeah, we're working on containment, but if for some reason or in some part of the country that were to fail, we have a plan for that too, to deal with trying to mitigate the spread. That might include canceling big events and making sure big groups of people aren't together. When we hear that, and is that enough to hear that they're working on it, or do you think they should be actually rolling out details of exactly what will happen when, if there is an outbreak, and at what stage different government actions might kick into place?
Yeah, well, the government should be as transparent with the public as possible. And there is some dissonance in terms of the messages the public is getting, because early on we heard from the government saying that given the low risk, it wasn't necessary to take certain measures, whether it was limiting flights, extra screening, those kinds of things. It wasn't necessary to do that. And then on the other hand, now we hear, don't worry, but stockpile food and medicine, kind of, very likely seeming contradictory messages. I understand that Mr. Varani wants to praise his government colleagues. Certainly on the public service side, we have professionals, we have experts that are likely advising them. But what the public is hearing, there's dissonance and there is a lack of clarity on that. So I think the government needs to, if they have a plan, to show the plan and to communicate clearly about what the risks and the right responses from Canadians are.
Mr. Davies, do you think a wider outbreak in this country is inevitable?
That's really hard to say. I think one thing that all parties share is that we all hope that this virus is contained very quickly, and that Canadians can get on with their lives, and that this virus can be basically it can cease being such a major public health concern as soon as possible. But on the other hand, vigilance and preparation are absolutely essential in this case, and I do think the time has come for the government to unveil a detailed plan and share that with Canadians, because being prepared in advance is key to containment. So we're not hearing from the government other than this vague kind of admonition to maybe be prepared. Well, what does that mean? I mean, why should we be worried? When the Minister of Health says that, people assume that she must have information that others don't have, and it creates a little feeling of panic. So I think it's time to come clean with Canadians, tell us what we need to know so that we can all adequately prepare in advance in case a pandemic does ultimately come to Canada.
All right, gentlemen, thanks for your time tonight. Do appreciate it. We'll continue to follow the story, of course.